I have been sharing with you over the past few years about the growing evidence of the health benefits of supplementing your diet with vitamin D. However, new evidence is now showing us the reason that it's so critical to have optimal levels of vitamin D in your bodies. Just a few years ago, vitamin D was simply looked at as the bone vitamin. However, several researchers, including Michael Hollick, MD, a pioneer in vitamin D research, have shown that nearly every tissue and cell type in the body has receptors for vitamin D. In other words, the very presence of specific receptors for vitamin D now defines vitamin D more as a hormone rather than a vitamin. This discovery has radically changed how we understand the role of vitamin D in the body. It is now becoming evident that we need higher levels of vitamin D to support optimal function of our heart, brain, immune system, and also maintain metabolic control. Our heart, blood vessels, and other components of our cardiovascular system contain a large number of vitamin D receptors, which means they rely heavily on optimal levels of vitamin D for optimal function. Vitamin D is needed to decrease inflammation in your arteries, while at the same time making your arteries more pliable and resistant to stiffening and hardening. The beta cells of the pancreas, where insulin is produced, also contains large numbers of vitamin D receptors. Vitamin D supplementation has been shown to improve insulin production, glucose clearance, and in turn, insulin sensitivity. Our brains rely heavily on vitamin D because each brain cell contains also a large number of vitamin D receptors. Vitamin D has been shown to have a critical role in nerve cell growth, nerve transmission, and decreasing inflammation in the brain, which is critical in improving normal learning and memory. Animal studies are now showing that vitamin D supplementation can actually decrease the inflammatory protein called amyloid beta, which is the hallmark finding in Alzheimer's dementia. There are now several clinical trials looking at the health benefits of supplementing vitamin D in patients with neurodegenerative diseases, especially Alzheimer's dementia and Parkinson's disease. Vitamin D receptors are also found in the cells that regulate tumor growth and cancer surveillance, especially in the cells of the skin, colon, prostate, and breast. Research is showing that in cancer cells, the vitamin D levels are dramatically reduced, which leads to rapid, out-of-control growth of the cancer cells. The cells of our immune system contain a large number of vitamin D receptors, and maintaining optimal levels of vitamin D is critical for proper and optimal functioning of our immune system. This is why we are seeing so many studies that demonstrate the fact that inadequate levels of vitamin D plays a critical role in the onset, progression, and severity of several different autoimmune diseases like MS, rheumatoid arthritis, lupus, and Crohn's disease. So what is the answer to this problem? Well, it's really quite easy. Everyone needs to be supplementing their diet with vitamin D. However, the amount of vitamin D needed has certainly changed over just the past couple of years as we now begin to appreciate the fact that vitamin D is really more of a hormone than just a vitamin. Many physicians are now getting vitamin D blood levels on their patients, which is called 25-hydroxy vitamin D. Most consider any vitamin D blood level below 30 nanograms per ml as deficient. However, as more and more research is being done on vitamin D, most researchers want their patients' vitamin D levels to at least be above 50 nanograms per ml. As a specialist in nutritional medicine, I actually want to see my patients' vitamin D levels to be between 60 and 90 nanograms per ml. This means that over 90% of the world's population is presently deficient in vitamin D. Therefore, I am now recommending that all of my patients supplement with 2,000 to 4,000 IU of vitamin D3 daily, which is the most active form and most potent form of vitamin D. Now, if you are able to get your blood level checked by your physician, you may find that you actually need to be supplementing even more to achieve these optimal levels of vitamin D in your body. However, for the overwhelming majority of my patients, supplementing with just 2,000 to 4,000 IUs of vitamin D3 is not only adequate to achieve these optimal levels, but also is a very safe level. Because of the significance of this new research and the importance to everyone's health, I will be sharing in more detail the specific health benefits of maintaining optimal levels of vitamin D in the next few medical minutes.